Thank you for attending. Thank you for attending this critical panel discussion on health equity and whole person care. My name is Kim Bojórquez, and I'm the Latino Communities Reporter for the Sacramento Bee and Report for America. I'll be moderating the panel. Today's panel will be recorded. All attendee Zoom lines will be muted, and we encourage you to ask questions using your Q&A or chat feature, and we'll do our best to group together similar questions if there's time at the end of the event. Now, I'd like to introduce our host, Carolyn Ingram, Executive Vice President of External Affairs for Molina Healthcare, who is hosting this panel discussion. Carolyn, I'll turn it over to you.
Thank you so much, Kim, and thank you everyone for joining today. We're very excited to bring this panel forward to everyone. Some of the work that Molina does around the state is making sure that we're out there promoting health insurance coverage to all populations and making sure that they're able to get high quality access to holistic coverage across the state. And so we're happy today to be able to bring these panelists to you to talk about some of their innovative approaches in ways that they reach out to improve the lives of members, both in their physical, behavioral, and social aspects of trying to meet the outcomes of improving their care and increasing the quality of care and services that they get across the board. Molina really focuses in our work on trying to reach people in vulnerable communities, and I'll talk a little bit more about that later today. But Kim, let's maybe go first to our panelists so that we can get them introduced and start some of the discussion.
All right, thank you, Carolyn. And I just want to thank Molina Healthcare as well as the MolinaCares Accord for bringing together today's panel experts. Today's panelists include Rachel Rios, who is the Executive Director of La Familia Counseling Center, a nonprofit agency in Sacramento, California. Ms. Rios has over 30 years of diverse experience working with youth and community issues. Ms. Rios began her leadership role at La Familia in 2012. Prior to coming to La Familia Counseling Center, Ms. Rios had a long career with the state of California in the Division of Juvenile Justice, formerly known as the California Youth Authority. Kiran Savage is the Executive Director of the California Pan-Ethnic Health Network. CPAN is a statewide multicultural health advocacy organization focused on eliminating persistent health inequities and addressing structural racism in healthcare. Prior to becoming Executive Director in 2019, Kiran served as CPAN's Deputy Director and Health Integration Policy Director. In those roles, she was the chief architect of many CPAN bills, in particular, the groundbreaking bill to prohibit hospital patient dumping that became California law in 2018. Rhonda M. Smith is the 13-year breast cancer survivor and has parlayed her experience into a passion for community engagement, advocacy, and policy work to address health disparities. Rhonda currently serves as the Executive Director of the California Black Health Network. She was the Executive Director of the Life Serve Youth Foundation and as the Interim Executive Director for Integrative Medicine for the Underserved. Prior to her tenure with I Am For Us, Rhonda was the Consultant Project Director for the Live Healthy OC Initiative, a 3-year initiative that aimed to transform the model of care of a network of FQHCs from a disease-focused treatment model to prevention and wellness model, providing whole person care approach. Now, I'd like to start broad, and I'd like to each panelist of an overview of how the COVID-19 pandemic has disproportionately impacted the communities that you serve. First, Rachel, could you talk to me about how the COVID-19 pandemic transformed your work at La Familia Counseling Center in the last year and a half?
Yeah, I don't think our agency, just like everyone throughout the world, wasn't impacted by COVID-19, both in the way that we service our community, which is very relational, to having to go to a telehealth model of doing both mental health services or porch visits with our families, our young people being able to, work with them in a whole new way. But I think, some of the really biggest impacts that it had on our organization is that we had to become a community health clinic. We had to actually become the center where people would come and get tested, or where they would get information about COVID, where they could get information in their language. We had to become the vaccination pop-up sites and advocate for that. We hired a group of community health workers that were diverse, that spoke Farsi and Arabic and Hmong and Spanish and many languages to be able to serve all of the diverse communities that in the areas that we serve, because it wasn't happening anywhere else. And I think one of the biggest impacts is that we had to become advocates. We are a service delivery organization, and all of a sudden we found ourselves having to advocate for our communities. If La Familia has to say to public health, you need to have this information in Spanish, there's something wrong with our system, right? And that's what we had to do because our communities were being infected at just all-time rates and we couldn't stand by. So we had to get out of our comfort zone and somewhat push our friends and our funders who we love, but to say, you can't neglect our community. We had to go out and work with our farm workers and let people know that these people weren't getting infected because they were out partying and doing things with their family, but because they were our essential workers that didn't have the opportunity to stay home. You can't telecommute and pick crops, you know, and they were providing the backbone for our economy. And so we really had to push and get out of our comfort zone and become an advocate for our community. In addition to all the ways that many of us had to change the way we do services, those are some of the big ways that transformed our organization.
Got it. And Rhonda, talk to me about, what you faced at the California Black Health Network, and what were some of the biggest challenges that your organization faced when you were trying to respond to the needs of Black Californians during the pandemic?
Rhonda, I think you're on mute.
Thank you. Sorry about that. As I was saying, that you guys couldn't hear, like similar to Rachel, although we don't provide direct services, but a lot of what we do is outreach and education and engagement. And so for us, really trying to meet people where they are was a big challenge because we weren't able to obviously physically be out in the community and meet with people one-on-one. So we had to rely on platforms like this to really get information out to our community. And, part of the challenge with that was everybody spends a lot of time on Zoom. So trying to offer education information through Zoom when people were suffering from Zoom fatigue was a little challenging. And also trying to reach the hard to reach individuals when you're talking about communities that may have had, Wi-Fi or may have been Wi-Fi deserts makes it, made it a little more challenging too. And then also really confronting the issue of vaccine hesitancy when we're, flying in the face of mistrust of the medical community to begin with. And then also adding on to that, misinformation that was circulating in the community about the vaccine, the lack of information about the vaccines in terms of their longevity and their whole development process, and that it wasn't something that happened overnight. And then also just communicating information that could come from a trusted source. We hope to be that, but generally we work with and through individuals, at the community level and on the ground. So that was a bit more challenging for us too, but we started to think about how we could really access communities more directly. So we're looking to leveraging mobile technology to do more native text messaging as a way to do education outreach and connect with the community still, because we know COVID's not going away anytime soon, and we still need to get the information out there, especially now that we're seeing cases starting to creep up in the Black community. So.
And Kiran, you had a multicultural health advocacy organization, and I know you've been collecting stories from diverse individuals about what their experience has been like during the pandemic. Are there any stories that have stuck out to you or really resonated with you?
Yeah, thanks for the question, and also thanks for the invitation to be here today with my friends and colleagues, Rhonda and Rachel. It's really a pleasure. I think for the pandemic, we really can't overstate the devastation in particularly low-income communities of color, and that this will reverberate for a very long time. But at the same time, I think the stories that have really stuck out to me the most are really about, I think, the resilience and the brilliance in our communities. And just listening to Rachel and Rhonda sort of describe what their own organizations have done during the pandemic and that critical role that community-based organizations have played. I think for me, that is sort of the biggest thing that stands out, is that there have been these networks of mutual aid that were developed. There have been communities coming together across populations, right? These multicultural efforts to really reach people. That community-based organizations have really pivoted from what they traditionally do to really meet immediate needs. I mean, organizations have food banks now that never did, right? And organizations provide medical services that didn't, and organizations do outreach. And I think one of the points that Rachel made was really important too, like the extent to which we've seen community-based organizations and community members engage in policymaking. I mean, we've seen record turnout of community members at city council meetings because people can call in and, you know, people are organizing themselves in a different way. And so for me, I think really the stories that stand out are the ones about what these solutions that live within our communities. And I hope that's something we really learn from together going forward, is how do we continue to really build upon that?
Thank you. And moving to the next question, after laying out what we've seen in the last year and a half in terms of health disparities and inequity, what is happening today to address some of the systemic health disparities that were particularly magnified during the pandemic? Rhonda, would you like to answer that question first?
Yes, there we go again, right? Yeah, so you know, Kiran brought up the fact that a lot of community-based organizations really found creative ways to pivot during COVID. And so did we. You know, like I said before, a lot of the work that CBHN did was around community stakeholder convening events and being more, you know, in front of people. And so it forced us to really think about how do we still do the work that we do in terms of engaging the community without having to physically be present to do that. So we shifted our framework to really focus more on collaboration and community engagement and capacity building, but now we're doing a lot of that virtually. We started literally the Black Health Network, which is a virtual community where people can come and connect and collaborate and communicate and even do virtual networking with each other. We're in beta testing that right now, and the plan is to really fully launch that towards the end of the summer. So really trying to provide a place for people to still come together, but not in person. We are in the process of launching the campaign for Black Health Equity, which is a multi-year campaign to really address the disparities across the state. So our goal is to decrease disparities by 15% by the end of 2023. So we'll be doing a number of things under that umbrella as part of the components of the campaign. One example is to develop the new Black Health Agenda. Well, it will be the new Black Health and Policy Agenda. That will be this time around more of a statewide strategy and plan to address health disparities, and really engaging partners from the 10 communities across the state that we'll be focusing on in that process from the very beginning, so that on the other side of that strategy and plan, they'll be part of the implementation and execution at the county level and within the various communities where they represent. We're also launching an initiative after the end of the summer to really improve, or our aspiration is to improve health literacy so that we can really empower individuals and patients across the state to understand, learn how to advocate for themselves, like when they're trying to navigate their way through the healthcare system, to really understand how to prevent diseases from happening, or if they are dealing with a health condition, how they can more effectively manage that, and really be more at the center of their decision-making for their own healthcare and be more of a partner in that with their provider, or no matter who their provider is. So we're really finding ways to address health disparities from the individual standpoint, from the community, as well as the system level. So we also will be continuing to partner with, you know, Kiran and other like-minded organizations that focus on health equity to really drive things, or I should say change at the system level through our policy and advocacy work, because I believe if we're really going to see any shift or change, especially from a structural standpoint, we really need to focus at the system level when it comes to addressing health disparities and inequities that exist within the system of care. So yeah, and then for COVID, we are continuing to move forward, and we'll broaden our efforts around addressing vaccine hesitancy, especially now, again, because we're seeing an uptick in cases in the Black community, especially here in LA, where I live, and across the state as well. I mean, we know that there's still a lot of unvaccinated people in the community, and the cases that we're seeing are related to those who are partially vaccinated or unvaccinated. So that's one part of it, but also the other part of it is we know that there's a lot of underlying health conditions or chronic diseases that also are prevalent in the Black community, which makes individuals even more vulnerable now in the age of COVID. So, we've held various events through our Health Equity Forum to try to address vaccine hesitancy. We even had Dr. Kizzmekia Corbett participate in one of those events so that they could hear straight from the horse's mouth, so to speak, and from a trusted resource that they could connect and identify with, and really get their questions answered about the vaccine, its development, its safety, whether it's efficacious in the Black community or other populations of color. So we're really trying to really broaden our reach and what we've been doing in the past to provide more opportunities to really educate the community and find ways to connect with them.
Thank you, Rhonda. Now I'd like to turn it over to Carolyn as she introduces a special guest.
Thank you, everybody. And I want to welcome to our group Assemblyman member Mike Gipson. Thank you so much for joining us today. And we have people on kind of joining from across the country. So if you'll bear with me, I want to do a brief introduction. And first, on behalf of the MolinaCares Accord, I want to thank you for coming and speaking with us today and sharing your remarks and your thoughts about what we can do to start to move the needle across California. For folks who don't know Assemblyman Gipson yet, you're going to meet him today. He served as the Democratic Caucus Chair since 2016. He also chairs the Select Committee on Police Reform and the Select Committee on Infectious Diseases. And for the past 6 years, he has championed many budget priorities, including $15 million in the state's budget for the creation of sickle cell clinics across California, $45 million for community school partnerships, and $3 million for revitalizing the Compton Creek, just to name a few of the initiatives that you've been working on. In addition, he successfully fought planned cuts of about $30 million that were going to the Martin Luther King Hospital, which was on the verge of facing closure. And he's been a fierce advocate for our homeless populations, curbing gun violence, and making sure to protect the rights of immigrant families that a lot of us work with. So again, I want to thank you so much for joining us today. I'll turn it over to you to give us a few remarks and your thoughts.
Great. Thank you very much, Carolyn and Molina Healthcare, for welcoming me and allowing me to have a few words and be part of this great panel. There's so many familiar faces, but this morning when we talk about health equity, this morning, it is absolutely near and dear to me in terms of trying to look at things and approach things from a very equitable lens. I want to also thank the SAC Bee for moderating today's panel discussion. My partners and I say in crime, but they are certainly fighting in this fight with me, standing right beside me. I want to recognize California Pan-Ethnic Health Network for just being there every step of the way, and also the California Black Health Network for being there every step of the way as we try to make sure that we uncover and show disparities in our community. The topic today is about improving social determinants of health in vulnerable communities and finding ways to address communities who have been hit the hardest, which is communities of color, because of this pandemic. As many of you know, if you don't know, you will know. There's two Californias. I know that seems like a surprise to most of you, but there's two Californias. And we have one that is adequately served with resources, supporting healthy outcomes, and the other, historically and pervasively, have been overlooked in this space. Those who are overlooked are held back by a system that assigns value and determines opportunity based on demographics, income levels, even skin color. Today's Latinos, African Americans, Native Americans, API, my LGBTQ brothers and sisters, and low-income residents are truly bearing the blunt of this pandemic. Every statistics, every demographics will show what I just said to be true. What we need is our collective strategies to invest, to get in front of what is the cause of this health disparity in the first place. This is why I have championed a bill to directly address health disparities and the social determinants that leads to these outcomes that we are now faced with in our community. I've done this alongside of organizations also participating in this panel today. Again, the California Black Health Network, and also the California Pan-Ethnic Health Network, and many other supporters. Assembly Bill 1038 seeks to create a California California Equity Fund to reduce the unjust impact of COVID-19 now into the future. This bill calls for an awarding, and I also want to underscore that nothing like this has ever been done before. And so this is new territory, but we're excited about being able to break out the usual and do something that's unusual to help those who absolutely need it. So this bill calls for an awarding of a grant for nonprofit organizations, clinics, tribal organizations, and local health departments who have been hit the hardest by COVID across the state of California. These entitles will create a strategy tailored to local needs and address the root cause of inequities that exist before the pandemic has gotten worse. These issues include social determinants like housing, food insecurities, employment instabilities, under-resourced schools, childcare, community violence, hate crimes, and environmental injustice. For anyone who wondering why this approach is still needed, please note that communities of colors experience the highest rate of illness and premature death than any other communities in this state. And so that's why we have to do this work. When you look at the life expectancies of non-Hispanics, Black Americans is 4 years lower than other populations. I just said something. I want you to underscore and just listen to what I just said. Beyond the politics, beyond the tweets and the numbers of likes and follows, this is truly an effort to change, to create a paradigm shift in our communities of color and make people's lives better. So we are absolutely deliberate in this approach that we're taking today to fix something that is broken in our healthcare system, something that is broken in our communities, and turn this thing around. That's why I authored, but I'm also disappointed. I'm disappointed that the funding for the health equity AB 1038 was not included in the latest budget iteration. But I also want to underscore and thank the governor for prioritizing a historic $300 million annually committed of funding in the 2022 to impart support for health equity. And let me simply close by simply saying that we are very deliberate in this work. We have to do it because God forbid that another outbreak of another pandemic hits our community. We know who's going to be hit the hardest. We know who's going to be disenfranchised. We know who's going to be most vulnerable, and that's the communities of color. And we must do better because the people deserve better, and we're fighting on behalf of them. So I thank you for this opportunity. I thank you for, that this bill 1038 is now moving through the Senate. It's now in the Senate appropriation, and then it goes on from the Senate appropriation to the floor. I'm hopeful and continue to make sure and work extremely hard that this Governor Gavin's sign Assembly Bill 1038 into law after this process is over. So I thank my partners, and I thank you for giving me this opportunity. I thank the SAC Bee, but most of all, I want to also thank Molina Health for bringing this all together. So thank you very much.
Thank you so much for your remarks today, and we really appreciate it, and sharing where things are, in particular in terms of the legislation out there. We have a couple speakers that had started speaking about things that they're doing in the community, and so I'm going to have Kim take us back to some of that conversation in ways that we can address some of the issues that you brought up today, but also to make sure we share where people think that we need to go in the future. And so if you do have questions, feel free to send them into the chat. So Kim, I'll turn that back over to you so we can get on with some of our panel discussion. But if folks have questions for our panelists, please go ahead and submit in the chat. Thanks, Kim.
Thank you, Carolyn. I'm happy to dive into our panel again. Kiran, I'd like to ask you the same question I asked Rhonda earlier, which is what is happening today to address some of the systemic health disparities that were particularly magnified during the pandemic? And in your opinion, how does Assemblymember Gipson's Health Equity Fund legislation address it?
Yeah, great question. So I'll say CPEN as an organization, we're not a community-based organization providing services to the community. And so, you know, really want to lift up the work that Rachel and her organization and Rhonda and hers are doing. We are working on state policy issues, and so I can talk about a few of those, including the Health Equity Fund, which has two parts, has the part that the Assembly member talked about, and has another part that we've been working on and I think really excited about, which is the Racial Justice Innovation Fund. And so I'll say, why do we think this is necessary? You know, what we see with COVID is sort of building on top of generations of structural and systemic racism. And so what we believe is that we have to address those social determinants of health, and that's why we're so proud to support the Equity Fund and grateful for the Assembly members' leadership. And we really have to engage communities in innovative solutions that directly tackle structural, institutional, and systemic racism, right? So whether that's thinking about how our governments operate and how communities have a voice at the table, whether that's talking about how we make budgets and what that looks like, whether that's talking about how we collect data on communities and what is the story that we're telling about our communities and our needs and our solutions, that those are things that the state needs to be willing to dedicate funds to sort of exploring and trying things out. And some things will work and some things won't. And that's how we make progress, right? And so really, I think this fund in its entirety is going to be critical, and very much looking forward to working with the Assembly member and the legislature and the governor to get this done, right, in 2022. Very excited about that. I'll also say, you know, I think part of what we really learned from the pandemic and continue to learn is that what we know as healthcare doesn't always work. It isn't always the best solution, right? And so one thing that we have really embraced is sort of the concept of community-defined health and community-defined wellness and community-defined care, and understanding that that this might look sort of different than a medical model, right? And that we really need to embrace and invest in whether it's community-defined mental health practices, as the state has been doing through the California Reducing Disparities Project, community health workers who provide this critical linkage and advocacy for consumers, doulas, who really, I think, are critically important to improve our maternal and infant health outcomes. So really that we need to be going in the direction of embracing more of those. And then finally, I'll say, you know, we also believe that equity is about power, right? And we need to put more power back in the hands of communities. And part of what that means is accountability for the healthcare system. And so we're very focused on things like, you know, how we decide which health plans are providing services to consumers and what we pay for in terms of healthcare, and how we make sure that we really have health outcomes and health services that promote racial equity. And that will probably require looking at things a little differently and really having some measures and some metrics that communities believe are important that we hold our providers, our plans, and our state accountable to, so that we can really make progress towards racial equity.
Thank you, Kiran. And I'd like to turn things to Rachel. Rachel, I know Rhonda and Kiran are very much focused on statewide and policy solutions. What are you doing from a clinical and community-based standpoint with your outreach and your work with youth and families?
Yeah, well, really, thank you. Really piggybacking on what Kiran just said, we actually have a pilot community defined evidence practice program that's being researched right now. I know that we're working with CPEN on that as well. But, I really want to talk about how important that is, because everywhere you go, funders want evidence-based programs. But the reality is that a lot of those evidence-based programs were never normed on people of color. And so how do we know they work? But organizations like what Rhonda was talking about, like what La Familia does, we are working in the community. We know that we were able to turn Cortland zip code, the census tract, to green because we were out there working with those farm workers. We know that how we do business works, and that's what community defined evidence practices are, is giving community credit for the work they're doing. The other part, along with that, is the community health workers. We have been doing promotoras for years. And now we're calling them community health workers, and that's okay. Whatever you want to, navigators, whatever you want to call them. The fact is that they are community people, trusted messengers that are the voice for community. And so investing in them, providing them some education so that we have a standard and that they have jobs is super critical. So these are things at local levels that we're involved in, but they actually have statewide and national implications, right? Community health workers should be part of the healthcare continuum. They should be what healthcare programs are funding as well. It's a lot less expensive, a lot more effective, right? And so really pushing that. And then I think locally also, when you talk about the social determinants of health, you cannot ignore the disinvestments that occur in our neighborhoods. You cannot have a neighborhood that doesn't have a bus, that doesn't have a park, that doesn't have transportation, and call that a healthy community. And so we have to invest in our communities. We have to look at where they live, where people live, how they get around, how do they get healthcare, and bring healthcare to them. Bring services to them, invest in our communities. It should not be that your zip code determines your life expectancy. That should not be the case, but so much that happens. And the more you disinvest in a community, the harder it is. Right now, with all these relief funds, we are trying to get our business communities back again, but we're investing in those corridors that already had lots of investments. And it's even harder to invest in a place like Franklin Boulevard that needs a community health clinic and an opportunity center. So we really need to work on those. Those are local issues, but they really become state and national issues because it's the same thing everywhere, right? It impacts all of us. So I think those are some of the things. Obviously, we're doing a lot of local things, helping seniors. Like we started a group called Tecnosavios, Tech Savvy Seniors, because they were isolated during this time. And we actually started it a month before the pandemic. Had we been able to successfully launch, they would have been teaching us how to do Zoom, right? But we need to invest in our communities all the way around. We need to be able to have those services and recognize, again, back to the neighborhoods, many of our people in our neighborhoods don't have internet services. So how are those kids getting school, and how are they getting tutors? How are kids who don't speak English learning English when they were doing it at home? And we know that you have to be immersed in the language. So these are all things that we're doing individually or locally, but they have an impact statewide. So I'm super excited about the bill, and I believe that it will be funded.
Thank you, Rachel. And now I'd like to shift our focus to access to care and health coverage, which is a lot of what Rachel was just talking about. We know that California expanded its open enrollment period from May 15th and until the end of the year. Kiran, what is the key to ensuring Californians utilize the extended enrollment period to secure coverage, and what other considerations should be made?
Yeah, great question. And so I think, the way that we see it, coverage is sort of our minimum essential here for getting people healthcare. And so one of the things that we're super excited about, in addition to extending open enrollment, is extending coverage. And so folks may know there was some big movement on that in the state budget to expand eligibility for Medi-Cal. to our seniors all the way down to age 50. And so we'll still have a gap of people ages 27 to 49, which we really need to close, but it's significant progress on coverage. And so now our job is to get people enrolled, right? And so we know that we have folks who are newly eligible who need to get enrolled. We also know we have folks who have been eligible and are not enrolled in various kinds of coverage. And in fact, you know, we know a lot of people lost their coverage during the pandemic, right? And need to get signed up for state programs. And I think what we see continues to be really important is the role of community-based enrollers and community-based navigators who do the work of really reaching folks where they are, explaining the process, helping people. I mean, it's not an easy process, right? You've got to do the paperwork, you've got to produce information about yourself. Like, we have not made getting coverage easy. And so we really do rely on our community-based navigators to reach some of our populations that continue to have lower enrollment. For example, our folks who are experiencing homelessness, like the kind of outreach that it takes to get them enrolled is very specific and really intensive and really relies on the trust of community messengers. And so we need to continue to invest in our community-based enrollers and navigators to do that. The other thing I'll say is, you know, we see coverage as just the first step, right? And so we know there's a lot of people who have coverage and yet don't have healthcare. And so we think it's really important that we increase our points of access, that we really resource our community health centers and our other places that are both physically based in communities, but that also understand and I think can provide care that is culturally and linguistically appropriate and humble and really meets the needs of communities. And that, you know, we have pretty poor outcomes, right, for people of color in terms of health. And what we see, CPEN's done some research, and what we continue to hear from consumers is that people really have a lot of concern about their health care. People continue to experience discrimination, right? People continue to experience stigmatizing treatment. And that kind of thing turns people off of healthcare, right? Why would you want to go back to a doctor who didn't listen to your concerns, who didn't fix the problem that you came there for, right? And who made you feel bad. And so thinking about how do we really improve the quality or the value of healthcare for consumers, and particularly for low-income communities of color, I think is an essential part of really making the case for coverage too, and making sure that when people get their insurance, they're actually getting an opportunity to be healthy and to have healthcare.
And Rachel, can you talk to me about what the breakdown of coverage for the population you serve in terms of Medi-Cal, uninsured, the uninsured, or other coverage?
Yeah, so we're not funded. So I appreciate Kiran saying more resources. We're technically not funded to be a Medi-Cal enroller, but we were, and we couldn't stop because the community keeps coming to us. So just in this year, since January, we've enrolled almost 1,000 people in Medi-Cal. And we're not funded for it. We just have to do it because where else is the community going to go? Just like during this pandemic, we never closed our doors because where else is the community going to go? We had the computer lab so they could apply for services, and we have people here. So what we've done is we've taken a look at what our demographics are, and we found that about 90% of the people coming in were applying for Medi-Cal, and most of those were actually undocumented. And this really speaks to the need to having healthcare for all, because the pandemic doesn't discriminate. People are going to get sick regardless of whether they're documented immigrants or born here forever, right? And so we recognize the importance of having Medi-Cal and services for everyone. Again, just speaking about having covered California services, we did early on find a lot of people that are working, self-employed, small businesses that really wanted to participate in covered California. But you really need those trusted messengers to help people, and not only to get them insured, but to teach them how to use their Medi-Cal. So we have this book called Know Your Medi-Cal, and we'll do these workshops to teach them how to use that urgent call line instead of going to the emergency room, to teach them how to access services, and then to navigate them through those doctor visits. Because as Kiran said, if you have insurance, and even if you do or if you don't, you go to your doctor and they don't understand you, or you don't feel like you're being heard, you're not going to go back, and then you're not going to follow your treatment. So we also work with people to actually help them through that process so that they can get regular care to address chronic disease so it doesn't inflame and create a situation where they're in the emergency room. So yes, about 90% of the community that we are seeing are uninsured, and they're coming in applying for Medi-Cal, most of the time emergency Medi-Cal or MC13 if they're undocumented.
Thank you, Rachel. And Rhonda, I wanted to ask you, how critical is coverage to ensure care is focused on prevention and wellness rather than disease-focused treatment or emergency-related care?
Yeah, so I'd like to build on some things that Kiran said. I mean, you know, the California Black Health Network is a Cover California navigator. So we do enrollments across the state, and we have a network of certified enrollers. But we know that, you know, getting someone into healthcare coverage, like Kiran said, is just the first start or the beginning. You know, it doesn't necessarily mean that there's going to be utilization, or that that individual will have access to quality, equitable healthcare, or that they'll have a good experience when they actually try to utilize it or access it. And so we want to ensure that, you know, going back to a lot of the conversation, getting to the root cause of the problem. So we want to make sure that at the system level, that the experience is one that's pleasant and will, you know, really encourage people to come back and can develop a strong partnership with their provider. But as Rachel knows, health really happens outside of the four walls of the clinic. And so we can't really ensure that communities and individuals in those communities are healthy if we don't have the kind of investment where there's, you know, healthcare centers, there are safe places to walk and play, where there, you know, there's access to healthy, fresh foods. So all of those things are important and contribute to health, especially when we talk about things that we can prevent happening to us, like chronic diseases. And we know that there are three basic things that contribute to chronic diseases. That's lifestyle, access to nutritious and healthy foods, and also physical activity. And so if you're not able to really participate in life in that way in your community because of the disinvestment, then it really sets up barriers and really compromises the health overall of that community. But we also know that policies can create inequities, but on the flip side of that, can also create more equitable solutions for communities, like the Racial and Health Equity Fund that we're so gracious to have the support of from Mr. Gipson. And so it's important that we continue, right, to move in those directions and make sure that we address the root cause of the problems that contribute to health disparities, and then also just empower people with the knowledge and resources that they can have access to. I'm a big proponent of self-advocacy, but not everyone knows how to do that. So it shouldn't matter how much money an individual makes or where they live or how well educated they are. I think everybody should have access to equitable healthcare and know how to navigate the system of care. And so I talked earlier about really addressing things at the system level in addition to community and individual level. And, you know, we hope that through some of our policy work and with our partners that we are able to do more policy work that's aimed at, what I like to say, the system and the individuals that are providing care. There's been lots of policies to benefit people seeking care, but doing more things like SB 464, the perinatal equity bill, where it requires perinatal healthcare providers to go through implicit bias training. Like, we'd like to see more of that happen across primary care. Because when we talk about health literacy, we know that that happens on both sides of the relationship. Yes, individuals and patients need, you know, I think there's opportunity to improve it from that side of the relationship, but also, you know, from the provider perspective too, and ensuring that they're more cultural astute and aware and can engage in more cultural competence and cultural humility as they're dealing with patients, and really taking more of a personalized approach to dealing with patients, especially when it comes to primary care, and looking at the whole person. And we know that, you know, if someone is able to really understand what they can do to be more proactive about their health, then we can reduce the degree of chronic diseases and really give people the tools and knowledge and resources that they can, you know, engage in that for themselves. So.
Thank you, Rhonda. And I'd really like to bring Carolyn back into the discussion. Carolyn, can you talk to me about Molina's efforts to enroll and reach vulnerable Californians, which, you know, in relation to focusing on the Medi-Cal population, and what is the overall role of a health plan, and what role does it play in engaging and working with their members to deliver whole person care?
Yeah, thank you, Kim. And after listening to everybody today, I feel like, re-energized that we need to go out and do more now. But I'll address a couple of the things that we did during the pandemic, and then ways that we're kind of exploring now going into the future. My background is I used to be a Medicaid director for several years, and that's why I have so much gray hair over here. But during that time when we needed to get people enrolled, we would just go out into the community, right? And we would work with our managed care companies to make sure that we pushed them out into the community to get people enrolled. But because of COVID, we were stuck, not able to do some of the same types of things that normally we would have done for enrollment purposes. So we decided to do kind of a series of PSAs and put those out and run them across the state, really because we were trying to hit lots of different places where we thought people would be picking up information, whether it's on radio or TV or otherwise. We made them, culturally appropriate. We had different people speaking different languages, but to really try to make sure people knew that there was coverage availability and that the expansion options were out there for people to get enrolled. The other thing that we did is we went back and worked with some of our CBO partners, and we have everybody here today, it sounds like, does tremendous work in this area across the state of California. But we really tried to go back out to some of the churches that we work with, some of the areas where we know people in shelters who are going to see people who are underserved, or resource centers, and especially food banks, because we knew at that time people were starting to need to go to food banks for food, to make sure that they were able to educate people about coverage options and what assistance would they need there to get that done. And then the other thing that we worked with people on is when they started to help people who were qualified to enroll, is to make sure that if they were one of our partners in our network, that we went ahead and did some of that assessment up front about what does the person really need to be able to live safely in the community. Getting back to that whole thing that we're here to talk about whole person care, we really believe, it's not just your physical health needs and getting your prescriptions or your behavioral health needs, but also, as we've talked about today, all those things around the social determinants of health that people need. So we asked our partners to go ahead and start kind of an intake process so that the minute that we found out about our membership, we were able to meet some of those needs, whether it was hygiene kits and getting people things that they needed in that regard, trying to help them hook them up with food banks and pieces they would, or things they would need there, looking at housing options and transportation if they needed to get to appointments or needed to get to things, so that we could really launch kind of a care around a whole person. The other piece I just want to talk about briefly is some of the work that we do nationally. And the reason it's important, I think, for this conversation and the folks that we have here today is our CEO came and said, a lot of the same things that people have brought up about, COVID has really hit communities of color. We see it across all of where we serve populations. Molina specializes in going into communities that are underserved. And so he decided to launch this thing called the MolinaCares Accord. And that's why we've brought everybody together today. We now have launched it across the nation. We have 18 chapters across the US. And we have conversations like this so that we can share some of the innovations like that Rachel and Rhonda and Kiran are working on back with other states and what they're doing there. And then not just share that information, but also come with a funding commitment so that we can help bring some much needed dollars to those community activities to be able to help elevate things and raise things up to make them better in those communities. So, I have to say, our CEO really stepped up, I think, in terms of leadership about what can we do to address this across all parts of Molina. So the conversation today, we will go back and share, across whether it's Ohio or New York or Florida or New Mexico, Nevada, these types of ideas and conversations so we can help spread this work across all of the communities that we're working in.
Thank you, Carolyn. And I would like to ask one last question to our panelists before we go into the Q&A portion of this event. And if we could keep our answers a little bit brief so that we could get to those questions, I would appreciate it. A pandemic might strike sooner than we think. And in your opinion, what is the most immediate need that needs to be addressed to prevent the disproportionate impact of a pandemic on communities of color? Rachel, would you like to answer that first?
Sure, thank you. Healthcare for all. We need to have healthcare so that everyone can get healthcare. We need to recognize the importance of community healthcare. That really, you know, as Rhonda was saying, health happens in communities, and we need to invest in our communities so that we can have healthier communities. We as a Latino population have to be at the table. It is not acceptable that 56% of the COVID cases in California were Latinx. 46, almost 50% of the people who died were Latinx. And yet many times we were not even in the conversation about how we were going to address it. That cannot exist anymore. Latinos have to be on the conversation, nothing for us without us. There is not a one size fits all for any of this. I know we want an easy answer, but there isn't. We need to recognize that having individual strategies does not mean we're not working together, because we need to continue to build these coalitions with information like that everyone is sharing here so we can learn from each other. But it doesn't mean that we have a one size fits all for all of us. We have to be strategic about how we are working with different communities. We are so blessed to have such a diverse state and community, and we need to honor that by having diverse strategies. So honoring each other, and lastly, changing the narrative around immigrant populations. They have held this state together. They've worked, they've fed us, the farm workers have fed us. We did not have food shortages throughout this pandemic. We need to stop vilifying them. We need to honor them, thank them for being those essential workers. These are the things we need to do immediately. And we cannot keep our eye off of this COVID. It is not over. As Rhonda was talking about, as we see the upticks in one community, we know that they're going to impact other communities. So we still have to stay vigilant. We cannot take a break yet. It's not time for us to let go of this. We need to continue these efforts and take the lessons that we've learned.
And Rhonda, what are your thoughts?
I don't know if there's much left to say after what Rachel said, other than, yeah, we definitely need to ensure that people do get vaccinated. I mean, if you have seen the recent data, you see that most of the cases, and definitely, unfortunately, people who have succumbed to COVID are the ones who have not been vaccinated or partially vaccinated. So for me, that stresses the importance of getting vaccinated, but also when we think about whole person care and prevention, you know, we're getting the vaccine to prevent something from happening, not necessarily treating a disease. And so I think shifting our mindset about prevention across the entire spectrum, you know, including COVID, is something that's important. So it's really a shift in mindset when we talk about preventing diseases from occurring, including COVID, which is more deadly than any chronic disease can be, definitely in the more immediate term. So I know we're going to be working a lot harder to make sure that we do our part to ensure not just access to vaccines, but definitely helping to dispel some of the myths and, you know, increase confidence in the vaccine, and really, you know, whatever is getting in the way of that happening, we'll do our part to dismantle those barriers. So.
And Kiran, do you have anything to add to that question?
Yeah, I was gonna say ditto to Rhonda, because I was gonna say this pandemic is not over, and it won't be over, right, until we really are able to get folks vaccinated. And so just to say that, I think the other thing, you know, we really think about everything we saw with COVID being a crisis within a crisis. And so I think we believe that the other public health crisis we're in is racism, right, and have been in for a long time, and that what we saw with COVID, the disparities that we saw, they were both predictable and preventable, right? And so if we are really going to change things so that this doesn't happen again and doesn't continue to happen, because it's not just the pandemic, right? It's everything. Then we believe we have to recognize racism as a public health crisis, that the state needs to take action. That includes investing in communities, and that includes looking at all of how we make decisions, our policy making, our government structures at the state and local level, and saying, how do we begin to dismantle what is so embedded in everything we do and really move towards racial equity.
Thank you, Kiran. And now we're at the Q&A portion of our event. One question is, a renewed outbreak is impacting communities of color in California. What has prevented them from receiving vaccines, and what can be done to alleviate fears to provide additional opportunities for vaccines? Kiran, would you like to answer that question first?
I actually would love to hear Rachel and Rhonda answer that question because they're really working directly in communities.
Rachel, you want to go first?
Okay, sure. So what's preventing, I think Rhonda talked about people's fears that they have, long years of mistrust of the government. But a lot of it is also just access. And so we still have communities like our rural communities that don't have access. They work all day long, 12-hour days. Where are they going to go? And some of the pharmacies we've had to address that when they go in to get their vaccination, they want documentation, they want a healthcare card, they want information. And so they don't have that, so they just leave. And so access still is an issue. And we did those big outreach events and we did those big pop-ups and we were getting thousands of people. It's not that way anymore. We've got to go individually and talk to people and hear what their concerns are, what their fears are. They may have known someone, and you need to have trusted messengers. There are historical reasons why people mistrust the government. And so we need to address those issues. And even today, we were hearing different information about vaccines, right? And so people are saying, see, I told you. And so we need to get really good information out there. But it's about making those connections with people, giving them access to the vaccines, and then just being there to support them throughout this process. Those are the things that we're doing.
Yeah. And I would add to that, when I talk to people about their hesitancy or whatever they say about the vaccine, I try to let them know that, hey, these vaccines were not developed overnight. Like the mRNA vaccine was developed more than a decade ago. And, for the first time really in the history of clinical trials, there has never, ever been as much diversity in terms of participation, especially when you look at the Black community than ever before. And I say, you take heart medication, you take high blood pressure medication, you trust that that medication is going to work for you, right? And those haven't had the kind of participation like we see with the COVID-19 vaccine. And so I try to do my part to dispel the myths and try to educate people one-on-one to let them know those facts versus the myths or any misinformation that's been circulating in the community. And I try to share my own personal story too. I went through my own journey, and moving towards vaccine confidence. And so, I try to do my part. We try to do our part as an organization to really educate and provide the facts to dispel some of those myths that that people have bought into. So I hope that'll make some change. And then, meeting people where they are, like you, I think, alluded to, Rachel. We're trying to deploy technology to really get information and literally into the hands of people. And that's what we'll be doing going forward, because everybody's not on Zoom or has access to Zoom, but pretty much everybody has a mobile phone. So if we can get information in an easily digestible and consumable way to people through that mode of technology, then we're going to pursue that avenue as well.
Thank you for those last remarks. And I'm going to turn it over to Carolyn to close out the event.
Well, thank you so much, Kim, for hosting us today. And I want to thank all of our great speakers. Everybody has given, I think, me and our team a lot of energy to go back and start looking at things that we need to do to get things done. And I hope that people who've joined us today feel some of that energy as well, and have got some good ideas coming out of this meeting that we're able to bring forward. And, one of the things that my dad taught me, I always keep this picture back here of him because he worked on legislation to get the Peace Corps going, is that it's our responsibility, each one of us individually, to make sure that we give back to our communities. So we can do a lot through our jobs, and I'm proud to work at Molina because we support a lot of those activities, but I also encourage everybody who joined today, just to take some of that time and think about how you can also give back in a personal way to your community to help address some of these issues. So Kim, again, thank you for joining today. People who didn't get your question in the chat, please feel free to email us at molinacares.com and send in your questions. Again, we're going to be sharing a lot of the learnings out of this process nationally with all of our other state chapters. And so we're appreciative of all the time and the efforts. And especially individually from the bottom of my heart, I want to thank each of our speakers for all the work they're doing out there in the community. I mean, it's a tremendous amount of work and never giving up in terms of the support that they're giving to our community there in California. So thank you again so much for joining today, and we'll be in touch. Appreciate it.